My name is Heather. I'm a VA staff, but I don't speak on behalf of the VA, and I'm just here because I care about veterans, and veterans deserve excellent care, and we want to provide it to them. 80,000 jobs being cut will not help us.
And how long have you worked here?
I've worked at the VA for 17 years.
Long time.
Yeah.
And are you concerned? I mean, they've kind of had cutbacks of staff. How is that going to affect it? They say that it isn't going to affect everything's being done to take care of veterans?
Yeah, I think the changes that are happening are already causing reductions in staff because they're trying to make it a place where people don't want to work. They're trying to make working conditions more challenging. Folks, especially in mental health, are coming back to work in places where they're having to, they don't have the privacy that they should have.
And mental health, I mean, the survivors of war have a lot of problems. The rate of suicide is very high. I mean, is that a concern that as a result of this, that veterans are going to feel that they're not being taken care of?
I have concerns that cuts to services are going to mean that people are going to get sick or they're going to lose their lives. So it's very important to be out here, and it's very important for people to stand up and call their elected officials.
And the stress for the workers here, a lot of workers have a sympathy for their patients here.
We're here because we care. We're here to do to help veterans, and we appreciate their service, and we want to serve them.
But that's me.
Just let us work.
My name is Duel, and I'm here just to support the VA workers. I know how hard they work, and I'm here to support them.
Are you concerned about the future of the VA?
Well, I'm concerned about a reckless and haphazard cut of 80,000 people from any organization with the claim that it's not going to affect services. I don't see that being possible. So, reduction.
Why do you think they're doing it?
If I knew the answer to that, I probably wouldn't be here on this corner. I'd be somewhere else taking care of business, but it doesn't make any sense.
My name's John Acoin. I'm here because of the cuts to the VA. And I mean, the cuts, I'm here for all. I've been going to a number of protests, including the VA protests, Tesla protests, hands-on. I don't like what's going on.
Musk and Doge say that they want to make things more efficient, and they're going to make an AI and make things better. You don't believe that?
If you believe that, I got a bridge I'll sell you. It's orange. It's not too far from here.
So what's behind it? Why are they doing these kind of things?
I'm sorry?
Why are they making these cuts? What's behind it?
Money. I think it's profit. Just, they want to privatize things. They want to make it, they want to make money. They want to make money off all this. Instead of really giving people care, they want to make money.
And what is it going to mean to the veterans if they don't get the care?
Well, it means delays, the quality of care is going to diminish. I mean, it's going to go downhill, and there's going to be longer waits for everything. It can't get any better. You take a significant part of the workforce away. There's no way it's going to get better. It's going to only get worse.
And some of the veterans have been through, chemical contamination.
Exactly.
I mean, all kinds of things. I mean, they got serious health problems.
Yeah, and we just, they're cutting the number of people that are employed by the VA at the same time that we just recently got more people into the system because of that, what you were talking about. So, it's horrific.
What should happen to Trump and Doge and that program? What's going to stop it? 'Cause it seems like they're going to do it regardless. They don't really give a damn.
All we can do legally, peacefully, is wait till the next election and hope they give enough rope. They're going to hang themselves, and hope we still get to vote when that.
You're worried about a coup d'etat or martial law?
I've said it. This is, to me, sometimes it seems like a slow motion coup. I mean, they're getting rid of all the generals that aren't loyal to Trump. It's frightening. I mean, we should be worried. People should be worried, and I'm worried.
Well, Trump said he didn't. If the Christian fundamentalists voted for him, they wouldn't have to have another election.
Yeah, I remember that. That's interesting, isn't it?
Okay.
My name is Jeanette, and I live in a neighborhood. I came because my grandfather was a veteran and he was a patient here. He's passed away, And I also have an uncle who was a Vietnam veteran, still a patient here as well. And I heard about the 80,000 employees cuts. So I walk over to support the veterans. So this is the third week that we protest here at the Veteran Hospital.
You're worried that it's going to affect the veterans here as far as their care?
The veterans care and also the employees, everything, yes. So that's why I'm here protesting and supporting the veterans.
My name is Ricardo Ortiz, and I'm a veteran, and I am a disabled veteran, and I get my care at the San Francisco VA.
So what's going on here? Are the threats of layoffs affecting people, and what is the aim of the Trump Musk government?
Well, let's start by the last thing that you asked. I am convinced that the objective of the Trump administration it is to privatize the whole system and give the VA hospitals to the billionaire insurance companies. That's what I think. And definitely all these cuts that already are going on are affecting, the capacity of veterans to have access to services, laying off clerks and other employees, delays appointments, affects health among us.
And there's some concern about the stress on workers and cutbacks that's going to lead to suicides, and that veterans who need immediate service aren't going to get them. Is that you feel that that's going to happen?
Yeah, that everybody fears that. And, among the veterans population, there is a lot of vets that are affected by post-traumatic stress disorder, a lot of traumas, military related due to participation in combat and war. And, there are services that are simple, that are needed, as for example, the suicide hotlines, where specialists and, healthcare, mental health care counselors could assist veterans when they're in crisis.
So is this going to lead to deaths? I mean, are they going to be killing veterans because they want to save money or want to privatize the system?
Well, definitely, if you reduce workforce and services, that's what it will result. It will be going back to the 70s and 80s that, a lot of veterans were committing suicide due to that. And actually, even a guys that returned from Afghanistan and the Iraq wars, a high percentage of them have committed suicide. So if you take away the ability of accessing mental health specialists, definitely that will be a result.
And who are these people, Musk and his gang? I mean, who do they represent? I mean, they kind of have this ideology that we can replace people with AI, get rid of workers, and AI will make money, and they'll have their own companies doing it.
Well, definitely. I mean, they are billionaires, they are oligarchs, plutocrats, that they never, ever suffer of poverty a day in their lives. And, none of them ever wore a uniform of any of the services of the United States Armed Forces. None of them, even from the present so-called commander-in-chief.
He had a bone spur, didn't he, to keep
So that's what he claimed, But I see him, even that he's an elderly person, he's playing golf every time that he gets, So, it's questionable.
And what were the Democrats' role? Because the effort to privatize the VA has been going on for some time.
Oh, definitely. I mean, subcontracting has occurred since, all these Democrats like Clinton, Biden. I mean, they also make cuts on subcontracted services. They are guilty of that. And, obviously because they also receive money, from pharmaceuticals and all these other industries You don't see them picketing anywhere. They're just comfortable making, their salaries in Congress and, receiving campaign contributions from the same corporate interests.
And the privatization of Medicare Advantage, that's being supported not only by the Democrats but by unions who are selling Medicare Advantage. I mean, the veterans have a special law that they operate like a national health service for the veterans.
Exactly, but I just want to say in regards to that the VA was created by struggles of veterans. I mean, there was the bonus march in the 30s, the veterans encampments in Washington, D.C. in the same decade, fighting and demanding after, World War I veterans and other, military decade, that served during that era that were injured or mentally ill or whatever. They were protesting for, their injuries and their health issues to be taken care of. That's why they created the VA from a class struggle, practically. Not like a gift from politicians that they woke up one day and I decided, we're gonna give this to the veterans. No, actually, they threw the army to in the 30s in Washington D.C. to displace veterans that were encamping, and they were injured and sick, and they sent Colonel MacArthur at that time, to evade. Well, he was already a General Douglas MacArthur, to evict these vets.
And there is going to be another bonus march, I understand.
Yes, they just announced that there will be a march of veterans in D.C. on June 6th. So all vets and trade unionists, workers, students should head to Washington to support the veterans. We're fighting, our fight is their fight.
And the issue of fascism, are you concerned about what's going on with the rise of racist attacks and also threats against Canada, threats against Panama?
Of course, none of these things are good. Right-wing fascists are racist. They are against the interests of trade unions and organized labor. Canadian workers are our brothers and sisters, so we should fight together. They are not our enemies, and we must oppose any intent of our government to go to war against these countries.
And there were probably a lot of veterans who voted for Trump thinking he would defend Veterans Administration. You think there's a state of shock by some of the veterans?
Oh, definitely. I mean, a lot of them are saying that they regret what they did voting on last November in the elections. But everybody makes mistakes, and the best way to amend things is show up and defend the VA, defend the employees, defend our services and our benefits.
As a veteran, as an employee as well, so I'm both.
Well, I mean, it seems like veterans are actually being laid off who work for the VA. That must be devastating.
That's scary, and so, I just don't want to see our services get cut, obviously. I don't.
Okay.
Veterans get their services and their care get cut. I mean, I work in a cancer center, and what I can say is I want to hear a veteran tell me they can't get care or they get delayed care. That's my biggest concern, because it is something they earned, and we're here to help them through a very, very tough time.
My name is Emily Goldfarb, and I'm facilitating what we call a pod, like an affinity group, a group of about 25 of us who are involved in all kinds of resistance activities. And among many other things, we are prioritizing coming out here to oppose the treatment of veterans, oppose the cuts to the VA, oppose the firing of nurses and doctors who are here. And it's incredible that VAs who supported Trump and have supported especially Republican candidates, for the most part, are being as screwed over as everybody else. Seems nobody's left untouched now.
So he made a lot of promises that he was going to help out people. It seems like the veterans now are getting a little concerned that they're going to be without proper health care.
Yeah, well, I mean, he made promises to everybody, right? The economy was going to get better and the cost of eggs was going to go down, and every single promise he's made to every population so far is going nowhere. But veterans, I think we would have thought, for a variety of reasons, our veterans, but no, another failed promise.
Okay, so how long has this been going on, these protests?
Well, I believe that this one here just started about 3 weeks ago, and so we're getting the word out. This is the first week that I'm here, so we're getting the word out, and more people want to be doing what they can among all the other issues, but to make sure we're showing our support for veterans.
Well, also, Trump announced he also wants to turn Alcatraz into a prison. What do you think about that idea? I
think that we should stop talking about it, to tell you the truth. I think that this is it is the most ludicrous, idiotic, stupid idea that it kind of upsets me that people are taking it seriously enough to be covering it in all the media. And it's clearly just part of his strategy to take over every single news cycle. So we all know that it will never come to pass. And it's just like, why do we have to follow every single burp and fart of Donald Trump?
Are you worried about fascism in this country?
Of course I am. We're pretty close to it right now. Yeah,
How so?
we all should be close to it. Well, we have people who are, besides the treatment of the undocumented, which I care greatly about, they are human beings. We have people who also are lawful permanent residents, people who are citizens, people who show up at the ICE for the regular ICE hearings, children who are at school, they're being detained and deported. That is part of fascism. We have threats and intimidation around freedom of speech, freedom of assembly, attacking the judiciary, the treatment of the courts, arresting a judge. I mean, the list goes on and on and on. We are there.
What can people do about it?
There is so much to do. Oh my God, today I spend every morning, because I also help lead a group of people, tracking all the actions. Every single person, whatever your issue is, healthcare, education, veterans, immigrant rights, women's rights, reproductive health, democracy, everybody has something to do every day. Education, absolutely. I mean, there are, besides calling your representatives, besides sending postcards, every single day we can be out here on the streets of San Francisco, and the same thing is true all over the whole country. Red states, red towns, there's so much to do.
It seems like Trump and Musk are riling up the people.
Yeah, so we were saying...
They're agitating and riling up people in this country.
And they're riling up the broadest front of people who are coming together in agreement than we have seen in decades in this country. So as scared and pissed off as we all are, and the real harm that's taking place, there is beginning to show this little silver lining, which is that when we march, when we're at places, we are with the most diverse group of people, and we might disagree on a lot of things, but we agree that this has got to end. So that's a good thing for the movement. That is a good thing for the resistance. And they can keep going on pissing off every remaining person, because that's what it's going to take to bring them down.
Sure. My name is Mark Smith. I'm the National Federation of Federal Employees Local 1 President, representing healthcare workers here at the Veterans Healthcare Administration. And we're out here, protesting the proposed cuts to the Veterans Healthcare and Benefits. The Secretary and the Trump administration have announced a proposal to cut 80,000 jobs at the VA. And so we are out here trying to raise awareness and let them know that that's a bad idea. These cuts have already been impacting us here at the VA and CARE. They cut probationary workers originally, the Secretary and others are saying that those roles were not critical, but we know that many of those roles were critical. So just to give an example, they were cutting our police dispatcher was a worker who got cut, and that's a critical role. They dispatch obviously police. on the campus, keep our nurses safe, things like that. But also, they help to, coordinate with local police, do welfare checks of our patients if they're having medical issues, things like that. So just, things like that cause chaos and are just harmful to care.
And they're happening around the country. Are these kind of protests going on nationally?
Yeah, I would say that rallies like this, pickets, informational pickets, are happening around the country. We have one happening at the Santa Rosa Clinic up north, which is one of our clinics here at the healthcare system. But I've seen rallies at the San Diego VA, at the Asheville, North Carolina VA, at every VA, not every VA, but many VA clinics. Rallies like this are happening. Veterans are standing up. Healthcare workers are standing up. The public is standing up. No cuts to veterans care. No cuts to our services. That
June 7th.
So June 6th. June 6th, there is a march on Washington. The Unite for Vets Coalition, uniteforvets.org. Veterans are going to Washington to, fight for the benefits and healthcare that they've earned, as well as the jobs, right? Many of the folks who are being fired right now, illegally terminated across the federal government, are veterans themselves. They have served their country honorably and then, returned to good federal jobs where they're taking care of their fellow veterans or the public, and having these good union jobs, and they're being cut from their jobs, right? And not for good reasons in many cases, right? For some of those folks, they're probationary because they were promoted to a new job, right? Because they were high-performing, high-quality workers, were promoted to a new job, and then because of that promotion, were probationary and were let go for all kinds of unknown reasons. So
there's a growing anger and frustration in the VA among workers and among the patients that their future is threatened by these cuts.
Yeah, I would say anytime you propose massive cuts to public services that millions of Americans rely on every day, whether it's veterans health care, whether it's Medicaid or Medicare or SNAP benefits, all these things that are being proposed in the current budget, which, cuts social services, healthcare, and other spending to pay for tax cuts for billionaires. Anytime that happens, you're going to have people, working folks, people who rely on these services, disabled folks, are going to be angry and upset. And I think that's what you're seeing across the country.
And FAN, it's bringing together workers from different unions around the country?
The Federal Unionist Network, which you can go to federalunionist.net, is bringing together rank and file union members across unions and federal workers all across the federal government, coming together to say, no cuts, save our services. We want to take care of the American public, and we just want to be able to do that without interference, without chaos, and without disruption to the services that we provide to the American public, whether that's VA healthcare and benefits, whether that's Social Security, whether that's Medicaid, Medicare, SNAP benefits, farm services, right? If you're at the USDA, all of these things, we want to continue to provide services for the American public. That's what we took the oath to do, and that's what we are going to continue to do.